This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about what is patellofemoral pain syndrome. If you like this video, we put out new content weekly, so please like and subscribe. So patellofemoral pain syndrome it means that the kneecap rides in a groove on the femur. Femur is like, if you look at the top of the femur, it's kind of shaped like this, the kneecap's on here like this, and it's supposed to sort of go central, but sometimes it sort of bops around, and when it does, you can get a lot of pain in the front of the knee. It doesn't necessarily mean you have terrible cartilage damage. That's called patellofemoral chondromalacia, which is closely related. You can. But basically it means that for most people, you have pain in the front of your knee, pain with stairs, and it just hurts really bad in the front. So that's generally what it is, and it's because the kneecap isn't tracking correctly. So what do you do about it? Most of the time what really helps is physical therapy to sort of stretch your hamstrings out and strengthen the muscles around the knee so you can pull the kneecap into the appropriate position. So that it's not bopping around, so that it doesn't hurt when you do stairs when the knee cap engages into the femur, which happens at about 30 degrees. Now a lot of people will do like quad strengthening extensions. That usually makes it worse. You need to be able to strengthen your quads and the muscle and without sort of doing that. This is when like specific exercises and really physical therapy comes into play. Sometimes to help calm things down, I'll do a steroid injection into the joint followed by physical therapy. What that does is that decreases the inflammation and allows someone to make more progress with physical therapy. That usually gets rid of it mostly all the time. However, sometimes people have some anatomical problems where like the kneecap is just pulled too far to one side because the femur is sort of rotated, or the ligaments are tight, or the tibial tubercle, like the patellar tendon isn't quite lined up right. In those cases, those people sometimes have kneecap dislocations. In those cases, sometimes what someone will do is they'll actually move where the patellar tendon inserts on the tibial tubercle, and they'll actually move that so that the end result is, don't worry about the details, but the end result is it takes the kneecap from going over here and it kind of moves it to the center. Again, that's sort of a major surgery, but by and large, most people don't have things that significant, and they can get away with like physical therapy plus or minus a steroid injection. So I hope I was able to answer your question about what is patellofemoral pain syndrome. If you like this video, we put out new content weekly, so please like and subscribe. If you have any questions I didn't answer, feel free to leave them in the comments below. But I can't give you any specific medical advice about your condition because this video and all my videos are for educational purposes only.